Okay, you're up.
Good evening and welcome to this special meeting of the Webster Grove School District Board of Education. At our most recent meeting, we were forced to curtail the Q&A session between the board and the administration, and it was decided to hold a special session to make sure that all board members' questions were addressed. In advance of our last meeting, the board and the administration had received questions, and since then we've received many more as a result of the Facebook post and the request at the end of the last meeting. We received feedback from all our stakeholders, students, staff, parents, and members of the public, and I'd like to thank everyone for their input. Some of the groups of questions have been answered for some groups, but not for everyone. Over the next couple of weeks, the administration will update the FAQ or the record to provide these answers broadly. In the interest of time, this evening, we're going to try and concentrate on areas not already addressed. With this in mind and reflecting stakeholder feedback, as well as their own questions, the board has put together a series of questions intended to cover broad areas of concern. While we won't be going through every question we received, we do hope to cover all general topics raised. The board has already given the administration the task to move forward, and we trust that they will accomplish this in the manner that Dr. Simpson and his team believe is best, reflecting both the district's mission and the safety of students, staff, as well as the homes into which all will return at the end of the day. The intention of this meeting is to get answers to outstanding questions with the expectation that these will guide the decisions made by Dr. Simpson and his team as they implement their plan for the next phase of the school year. So I'd like to start, if I can have a motion to approve the agenda.
Make a motion to approve the agenda.
A second, please.
Second.
Okay, all in favor?
Aye.
Anybody opposed? Okay, so we have one item only on the agenda, and that is a Q&A session related to the 6 to 12 grade return to in-school learning. So I'm going to go around each of the board members to ask for questions. Many of these questions are in fact questions we've received as part of the process I outlined. Some questions may be board members' own questions, but we'll go around and answer those. And so if we'll start off with Keita, please. You're muted.
Okay, sorry.
Not to worry. Thank you.
I was trying to look at the questions. So some of the general questions that were sent, I kind of wouldn't mind if administration would kind of go through some of these questions that were sent in. And one of them was how did you arrive at the decision? What data? I guess I know you've gone through this. I know you've gone through this 100 times, but what kind of data and information are you using to arrive at the decision to return to school?
Yeah, I appreciate that, Keita. And for tonight, I just kind of want to stress a few things. First of all, the flexibility and agility that we must demonstrate in our approach with all things, data and information, decision-making, both within control and within our control and outside of our control, continues to evolve. And so I just kind of want to stress that important piece of the flexibility in response to a lot of the data and information that I share. So when making it the decision, I mean, that's the $24,000 decision for a lot of people. And really, there's a lot of different data points and factors that go into it. So from the onset, we've looked at obviously the COVID data since the onset of COVID in March. Things that we particularly look at, monitor on our website, looks at case rates, looks at positivity, and looks at averages 7 and 14. And then we also look at transmission. And also what we in turn look at is just how the data is affecting different people, stakeholder groups, such as our children. We have that data available to us. One of the key indicators that has emerged even more critical over the past couple months, I would say, is really paying attention to the transmission data, and not just the transmission data within our community, but really what is transmission data looking like within schools. And what we have seen since we've had adults back since April and some kids back since July and more since then, is that our ability to create a safe environment where transmission is minimal is a success. And that's something similar to what other schools around the county, the region have demonstrated. I'm in conversations with those superintendents all the time. You can see their dashboards online, and that's what a lot of the experts have stressed. The medical people that we're in conversations with weekly also will stress is that schools who are making kids wear and adults wear masks, that are mindful of spacing, that have good disinfecting and cleaning practice in place, are able to reduce any kind of transmission. We have also sought information from a number of different groups since the onset, students, staff, as well as our families. We've had a lot of different Zoom calls for a while. We've had surveys. We've had different staffing groups that we've met with in particular, both at school levels as well as our district issues committee. So there's been a lot of different sources of information that way. And lastly, like I mentioned, the experts with anything related to COVID, as everybody knows, since the day we kind of started going down this path, there's been, I would say some different good support from St. Louis County, not as much from the state level. We've been largely making decisions on our own. And we've been very grateful to have experts who have helped guide us along the way. Even today, I was on the line on a Zoom call with Dr. Jason Newland, Dr. Rachel Orschlin. Dr. Newland's video is uploaded to Board Docs. I strongly encourage everybody to watch that, but have been graced by having experts along the way. So when you hear them talk about what is successful and what you can do to open schools, those are also data and information. So I know also along that line, it's why now? And I can assure you with every decision we make, it comes from a place of care for our kids, care for our adults, care for our families. Decisions that we're making aren't easy decisions. They're not decisions that make our lives easier. Most often they make our lives more complex. And we have, while a number of kids are having success with the online experience, we have a number of children that are not. While some adults would rather stay home, we have some adults that were ready to come back or are glad they're back. So I think looking again at the quality of what we can provide, in person versus virtual, those were guides to our decision. And while making a transition at a semester or at a natural break would have been really easy for us, when you have kids that, when you have high school Fs where you have, a third more Fs than you had last year happening right now at the high school, that's a concern. When you hear all the different social emotional needs of kids, that's a concern. And so certainly not for ease of doing our operations on a district side or even at the school side. It's a kid-based decision. So those are the factors. And again, stressing the need to be flexible. And I'll just add to it. And I know I'm probably going over on this general question, but there are only 3 school districts right now in St. Louis County have not made the decision to go back in some form. And that's Third Floor, that is Maplewood Richmond Heights, and that is Hazelwood. All the other school districts are going back and again, faced with these tough decisions and do what they can for best for kids. So I'll be much more succinct with the other ones, but that's a big one that people want to know.
Okay, thank you, John. So what we're going to do is going to go around the board as we've done before on these. So Christine.
Thank you. Yeah, so we have 27 pages of questions from faculty, from staff, from, I'm assuming, parents, and possibly even from students.
Yeah, there are some from students as well, yeah.
relating to topics on health and safety, contract tracing, quarantine, questions about Hicks and about Steger, about Webster Groves High School, about cleaning, about data, about staff contributions, about curricular, about staff. And it's clear that there are a lot of questions out there. And I guess if I could boil it down to, what is the district doing to keep children and staff safe at school, and with all these questions still out there?
Yeah. I think, in terms of the safety, and Pam will jump in here too in a moment, and Sandy, but again, kind of like the experts have said, those three things are the most important things that we can do to minimize transmission. Because we know, just like you go to the grocery store, you go anywhere, COVID's going to walk in. It's our reality right now. And so some of the things that we're doing, really mindful of those three things, in terms of the mask, in terms of the sanitizing and disinfecting, in terms of the attention to space, and of course, having people stay home when they're not feeling well. So Pam, do you want to add to that? I know you had some thoughts related.
Sure. So we have put some other measures in place too, such as buying some trifold desk barriers that will go on desks when social distancing is not possible. We have plexiglass dividers for teachers who are working one-on-one with students. We are going to make sure that we frequently disinfect those high-touch areas, so they're getting done a couple times during the day. We'll be changing our HVAC filters every 2 months instead of every 4 months. And we're also running those systems a couple more hours every day, so that air is circulating through those filters more often. We also have moved desks into some classrooms that had tables where social distancing was going to be an obstacle. So we've moved desks into some of those classrooms that we had in storage. And we're also looking at ordering more desks. As John mentioned, we are putting hand sanitizer in the buildings. We have it in the classrooms, every classroom. The elementary classrooms have a half-gallon size in their room. The secondary classrooms have a full gallon size in their room. We're encouraging hand washing. And then we also have hand sanitizing stations throughout the buildings, in the hallways and the entrances.
Thank you. Amy?
I'd like to hold my question for now and let somebody else go, if that's okay.
Absolutely. Joe?
So I know we have the responsive learning plan and we have the virtual, but for people that picked the responsive learning plan but are now questioning that decision, feeling like it's not a good time for them to go back for whatever reason, maybe their circumstances have changed, why is it not possible to have some sort of camera in the room to so that they don't have to switch to launch or a different program? They can stay with the same class they've been in.
Yeah, thank you. That's another popular question, and I'll give a longer response, but I think context is really important to that. And I think so. When we originally designed our plan, which yes, we are mindful of the need to be flexible in plans, but we really looked at all kids in the entire system in order to make this decision. And we thought of what would be best for kids, what would be best for us, adults. And a lot of that had to come with continuity and community, continuity of programming and continuity of community. And while our teachers really wanted to just be in one space or another, either virtual or in person, and that was a goal of ours that we couldn't fulfill at some of our levels, that was important to be respectful of the monstrous task that they have to educate kids, and whether in the virtual setting, be attentive to the needs there, as well as the in-person setting, and how you teach and learn differently in those settings, and how when you come to the in-person setting in a time like this, you're more mindful of attention to structure, mass, spacing, and those kind of things. So we made the decision to create the two separate, the virtual program responsive learning, and work to communicate with people to, if you know that you, and again, we all have feelings of change, right? And I respect that. But if you were confident that you weren't going to want to go back unless COVID was gone, or and for sure for the semester, let's say, that you picked the virtual program. And if you are open to going back, if the district deems it safe, if we deemed it was safe to do so, pick the responsive learning plan. And that had those 3 particular tiers. We communicated that. And we communicated with elementary families that, you know, in this virtual plan, there's a probability, there's a likelihood that you may not have a teacher or any teachers from your school, just to be upfront with them. And Webster, that's a hard thing because you're connected. We were able to group all the kids with kids from their school, but there's a number of them that don't have their same teacher, and they're learning from teachers in other schools. And then with the 6 through 12, we told them that you're going to have access to fewer courses and elective opportunities. And we know it stinks. We know we don't want it, but we only have so many teachers. We only have so many classes. And not feeling like we have the capability or the desire, again, being mindful of what our teachers were saying, to operate in both spaces at the same time, and not thinking that was best. And so we were kind of upfront about that, and we asked people to declare, and then we dedicated a crazy amount of time into the school year, but a lot up front, to place kids in classes, to place kids in courses. We had to determine who are they going to be the adults to work with all those kids. And we have some teachers that are working, again, as a responsive and a virtual, and who are the teachers at that time who, for medical reasons, had to be in the virtual. And trying to place not just classes and courses, but you know, all the programming that goes on with kids, all the teachers that are touching kids, monstrous amount of work. So we designed everything around where people selected. And again, don't just think of it as courses and not. And so then we went about. And so why no movement at this point is, first of all, again, if we allow movement at this point, it could be a major, major disruption to the system. It's not necessarily a disruption if 1 moves or 2 moves, but if you move a decent number of kids, you're not just going to affect 1 classroom, you're going to affect multiple classroom, multiple courses, multiple programs, teacher shifting, classes having to move. And so that's why we made that particular decision, is that it'd be that disruption. It's also consistent with what we've done. And it's kind of also like we're trying to be mindful of the big burden and weight that is on all of our teachers right now, teaching where they are in the spaces that they are. Again, it's not complicated for us as administrative leadership to do, but for those that are the practitioners working there, it is. I will say that one thing that we're looking at, and especially now with changes in CDC guidelines, seems like they're changing every day, which is actually pretty concerning to our ability to be in person. For any of our kids, we have to be mindful of how we can do a better job of supporting our kids who are quarantined. Right now, our plan is for them to be kind of like do that asynchronous piece, but that's something that we have to be mindful of. So that's the rationale for it. That's the rationale.
So, John, I don't think that catches the essence of the question. So the question, I understand why people can't transition from one to the other. That makes good sense to me. To me, the question is, why can you not put a camera, a standing camera, fixed camera, pointed at the teacher's screen and with an audio feed, recognizing that's going to be a suboptimal option. The teachers don't need to teach to that. It's merely available as an alternative, so that if a child is quarantined, for instance, they can listen in on the class. The teacher is not going to be able to interact with them or anything else, but the child will at least be able to go and listen to the class without having to go and completely change. And to me, that seems, and this would be for high school. You can't do this for kindergarten or anything younger, but the high school, possibly the middle school, but definitely the high school. I think this is a feasible thing to go and add. And I guess that's the piece that's missing for me in your answer. And Amy, I did see you. I apologize. I'll catch you a second.
Well, we are trying to figure out on the quarantine side, what is the range of our capabilities with doing that, with doing something better than what we're doing currently right now, especially if we're going to be expected by the health department to quarantine more and more and more people, and we want to be in person. We've got to keep trying to figure out how can we better meet the needs of our kids and not stop with that. So we have looked at different possible cameras. Again, some of the fancy ones expensive, but there are obviously cheaper ways of doing that. But because this could be our life for a couple of years, at least. So it is something that we're trying to problem solve.
Okay, Amy, you had a question.
Follow up. Well,
okay, all right. So all right. Joe, why don't you go, and then Amy had a follow-up question as well, I think.
So I agree, Dave. You questioned that what I was really asking, which was just how's that gonna, why can't you just have a camera in the back of the room? So I guess assuming that you're saying that can't happen right now, can you explain how these kids that have already been in a class for however many weeks at this point are going to transition to, say, the launch program?
Yeah, I'll let Jason jump in there.
Can you hear me okay?
Yes.
Yes.
So let me provide hopefully a little bit more clarity than what I was able to do last week in regards to launch, and also another program which is called Edgenuity. Both are MOCAP vendors, and the high school has used Edgenuity to some degree in the past and to some degree this year as well. So if a student, and I will say that Dr. Denbo is working with us, and she's kind of our MOCAP liaison right now, helping to support us as we've worked with K-5 and as we are getting ready to work with secondary students. And so part of what we've been able to confirm with launch is that if a student were to begin a semester in person and then transition in that same course into a launch course, we would be able to place them based on the pacing to which they have already been able to reach in the in-person setting. So there may be a little bit of clunkiness, if you will, whenever that placement happens, but it's not as though they would, as I suggested last time, that they would have to start the entire course all over. With Edgenuity, Edgenuity operates slightly in a different way than what Launch does. Edgenuity, we have a site-based license, and so our counselors at the high school and our administrators at the high school have somewhat behind-the-scenes control and can also determine which modules and how to place students within the curriculum, within the pacing, based on what they've completed as well. In terms of grades, because I remember there were several questions related to that last week, the grades will transfer. We get a report from Launch, we get a report from Edgenuity that transfers into our student information system and allows us to document the credit and allows us to document the report and the grade in terms of both the percentage and in terms of the letter grade that can then transfer to that student. I think it's also important to know that with any student, because even outside of this year, we have accessed, Webster Groves has accessed MOCAP, that program, and several vendors through that program, that our counselors and our administration work to monitor the students who are in that program. Dr. Denbo is currently sending me a weekly report related to how students are performing, and then I'm passing that along to our high school counselors in terms of being able to reach out and support families. So we're continuing, it's not as though we're just removing them from our high school or removing them from our school. We're still trying our best to wrap our support around them and try to offer assistance as we can. I hope that answered your question.
That does answer my question. Thank you.
Amy?
Yeah, so I'm going to push back on this issue. And I think the reason that some of us feel so strongly about this particular idea of the kids who have been in responsive no longer being able to stay in responsive, but either choosing between going back in full-time in person or going to a non-Webster program like Launch. When we made the decision to go, not to start in August, to start virtually rather, the data we were looking at was transmission data in the community. What was the virus doing in the community? And those of us, and I heard you say several times, John, that you guys were transparent, and we were told that if we choose one option, we have to stay with it for the whole semester. If you choose responsive, then you're committing to staying in responsive unless the district decides that it's safe to return in person. But the problem I have with that is that those of us who made that decision at the time reasonably assumed that you wouldn't be sending us back in person when the community data spread numbers are actually worse. I think it was a reasonable assumption on all of our parts to say, well, if the numbers in the community are too high to start in person in August, you're not going to send them back when those numbers are even higher in October, November. And I understand that the difference is that the data you're using now is different data. It's the transmission data based on what other school districts have experienced and what we know about the virus spreading to other kids, between kids, and that's all well and good. But it seems unfair to me to hold parents to a decision that they were asked to make in August when you guys are now using different criteria. And so I still, at a bare minimum, I think a camera in the classroom is an improvement, but I would still advocate for kids who have come this far in doing virtual in the responsive learning plan. It just breaks my heart to think about them having to make this incredible transition to not having their teachers, not interacting with their classmates. And that's what it is. I mean, I'm not going to say anything negative about launch or the other MOCAP programs, but that is the reality of it. And that just seems really unfair and disruptive to their lives when they've already had enough disruption. And I just don't see the justification for doing that to them now. And again, it's not as if parents don't have reasonable concerns about not wanting to send their kids back now, given what the numbers are.
So a few things there. From a data standpoint, the data is still better now than it was when we made that decision. The transmission data, the case data, the positivity, transmission, all of that data is better today than it was then. It's not as good as it was September 29th when we made the decision to send our K through 2 back in transition, but the data is in a better spot. Now I realize some people,
but it's trending.
It is not going in a good direction the past few weeks. I would agree with. I think that's definitely reasonable. I think again, when making these decisions, I could argue your side too. I think for me, I'm trying to also be mindful of the complexities of trying to be child-centered, but also thinking through the challenges that come with the teacher and having kids in different settings. We, over the past few weeks, have had approximately 40 elementary school kids who weren't given the option to be in Webster Grove School District classroom, again, because of, and these are people that didn't self-select. They would have taken a Webster Grove School District virtual class if we could do that. But again, if we kind of opened it up, that would have created some interesting dynamics at a lot of those different classes. And then I think I also, again, feel for the people, and you're right, the data is different now, and I get that feelings change, and because I'm hearing from people and we're hearing from people in the questions. I'm also mindful of people that made a sacrifice at the beginning, and never had the option. And again, circumstances change, we got to be flexible. So, I don't know. That's just kind of where I am right now with it.
David, do you mind if since we're on the subject, may I jump in?
Please.
Really
Go ahead.
quick? So my question regarding recording the classes, I agree with Amy. It's a lot disruptive. And I'm thinking about kids who may just simply be sent home because they have a sore throat, or like I've had allergies all fall. So I've had a scratchy throat, but it's allergies. So, but if a kid goes to the nurse with a scratchy throat, then of course for all symptoms, the nurse has to send them home. And so there's a lot of this back and forth, back and forth, back and forth, back and forth. And then you're going to add on going from their class to virtual to a whole nother program on virtual. Is it not possible to simply record on Zoom the way that we do our meetings, and you share your information the way that you do your presentations, and it's available for kids to jump back to if they're at home, they still get to share, with their classmates. It's just that they're at home. I gotta feel like that's a lot of extra work for the teachers as well, to be able to check launch against what they have, and it just seems like a lot. Why can't we just record the classes on Zoom? And maybe it's a logistical thing. That's what I'm asking. Is it possible, or why can we not just simply record classes on Zoom to make them available for kids at home? And even just for kids to be able to refer back to, maybe for extra studying.
Jason, do you want to touch on that? I could respond to that, but why not?
Sure. So yes, part of it does go to the teacher piece with that. And so we have had, there have been issues in terms of, because that has been part of our virtual plan, for teachers to record their live instruction and then to place it into Canvas for students to be able to access at another point. And so what we found, and from feedback from staff, has really been that it takes an incredible amount of time to upload, because it's not a short video, it's several, you have to go through this process, and I'm not clearly explaining this, but then it has to be uploaded to Canvas, and it is very time consuming on that end. On the other end, and Bill, feel free to jump in at any point with this, but I know Bill and Tim have been taking a look at what our inventory looks like, especially at the high school and at Hickson, in terms of the technology to be able to maneuver through any possibility related to this conversation. And so to this point, we haven't been able to fully firm up what that could look like, but we are in the process of looking at our technology infrastructure, because it is different based on buildings. Hickson has one thing, the high school has something different. And so looking at how, if there is a possibility of how we could consistently do that, whether it's in a situation like quarantine or elsewhere.
I just go ahead, Bill. I heard you. Was that Bill or you?
So at the high school, we would have, the majority of the teachers have desktop computers in their classrooms. Those computers obviously don't have cameras or microphones on them, being a desktop. You would be looking at around 98 cameras needed in those spaces alone, just for the high school teachers. And then you have to start thinking about availability. Whereas a couple months ago, there was no availability for cameras. You couldn't get a webcam. Now they're starting to come back a bit, and you can pick up devices, but you would still have to look at availability and cost associated with that and getting those into those classes. And also at the end of the day, it's one more thing that you're putting on the teachers that are already pretty stressed.
Keita, I do think as much as we can, we're not sitting here saying that what we're doing, we feel like we're trying to be mindful of all these things, trying to do the best we can. But from a theoretical standpoint, I would love to do something like you're talking about. Like, I think we've talked about application for what we're learning now for when we're out of this pandemic, what we've learned, what would be good for kids, and trying to balance what we think would be good with also where our teachers are and being mindful of them too. So, and I'm not even saying that what we're doing right now for the rest of the semester is going to be exactly, I hope we're better. I hope second semester when we come out of the gate, we got more in place. That's what the goal is, to be better for our kids, to be better for our families. And we've also heard, not just middle school and high school, I know that's the context for a lot of the conversation, but we've had different elementary school kids that are on quarantine, and for them to be healthy and well and be home and, be disconnected from their room, that's hard. And there is technology that exists that makes it so much simpler. And that's one of the reasons why kind of partnering with the foundation, because we're, obviously this is costing a lot more money to do what we're doing now. Trying to partner like with the foundation on some of these fundraising efforts too, to try and Jason recently, purchased an OWL, looking at some of these cameras where we can do some of this stuff, makes it easier on teachers, and has some recording capabilities that, would work for situations like you're talking about. So.
Well, I do appreciate it. I'm not trying to get on anyone's case. I appreciate everyone's hard work. I know you guys are pulling your hair out trying to get this stuff done, and we appreciate that. I thought that, to me, and this is me not being in that process, it looked like it would be simpler to do it that way. So.
Yeah, the recording of the lessons is something we've definitely heard a lot about, the time that it's taking people to do it. That's something that we've talked about at the issues committee meeting too, is just the recording of those. But again, how can we make it simpler? Let's not stop and say barrier. Like, how can we make it simpler? How can we make it more doable?
Well, I guess, sorry, why do you have to record them? Why can't it just be like, my class is at 10 o'clock. I watch it with everybody else and then it's done.
Sure, definitely. You could definitely do a live stream component too. Keita was just talking about the recording. You could do the live stream. I think being mindful of, again, so I'd have students streaming in. So some of our teachers would be teaching a virtual class, teaching an in-person class, teaching an in-person class that has students also streaming in. It's just a lot, and a time where people have a lot on their plate. But that could be a solution that's kind of, this is an offering coming out of the gate.
And like David said, I think it would be where the teacher isn't expected to teach to those kids that are watching from home. The teacher would just do their normal class. But if you were at home and that was your only option, it would give you something.
That's kind of what I was thinking too.
That's really all I'm trying to get at as well.
Yeah.
And if that were only all the teachers had to do, and it was just a stream and there weren't questions, so some of the classes that might be easier to do, but some of the classes it wouldn't be as easy. So, because you teach your kids would have questions. Kids have questions. So again.
Okay, so this is one I feel quite strongly about, but I'm also conscious we've got a lot of other things we want to cover. So I think you've heard loud and clear, sort of, the feeling of a number of board members. I'm sure that you will, as you plan things. I trust that you will take that into account. Alex.
Yeah, thanks. Let's see. So my question's kind of about the structure of the days and why go into the different blocks. So why not do why did we decide to not maintain the 85-minute blocks that we've asked teachers and students to adjust to, and move to was it 40-minute blocks? And if we do have to go back to teaching online, are we is the expectation to switch again? So could you kind of go into that?
Jason, do you want to hit that?
Or would whoever is controlling the meeting, would you be able to allow me to share my screen? Just so I could provide a visual of the high school schedule.
You should be able to share your screen, Jason.
Yes, I can. Thank you. All right. So just to make sure everyone can see the schedule on my screen. So let me first, if I can just kind of walk through again what the schedule entails. So the idea is when you're talking about a hybrid schedule, hybrid, we all know means half. And so to some degree. And so as we've been looking at hybrid schedules, different districts are running different schedules. And so our high school, and part of our discussions, to your point or to your question, was do we do 2 full days of in-person learning, maintaining the same block, or do we try for more opportunities across the week for students to be in school? And so in work with the Webster Groves High School leadership team, the decision, folks really felt strongly that we wanted to see our kids more often rather than 2 full days a week. We wanted to see them 4 days a week, even if it was half the time, so that we could continue to monitor them, so that we could check in on their health and well-being, so that we had 4 days where we were able to make that one-on-one connection with our kids. And so I could say a lot of other things went into that thinking, but that was really the driving piece as to why we went with an AM PM versus an A day or versus a B day, was the opportunity to be able to connect with kids more often throughout the week. In terms of the way the schedule works, you're right, the blocks did shift from 90 minutes down to a 40-minute period. And so because it does have to be cut in half in a hybrid situation, part of the additional time did go to this middle section, which is where lunch and cleaning occur. And this was to transition and allow space for one group of students to leave, the other group of students to come in, and to be able to prepare that space. In any hybrid situation, I have to say it's going to be vital in terms of the asynchronous work that's provided for students. Since time is reduced in terms of live instruction, it's going to be crucial that the asynchronous work that is provided from teachers is of the high quality, is engaging, is continuing the content. And so part of our work has been, in terms of the learning department, has been to share some additional guidance with the Webster Groves High School administration around what does asynchronous look like, especially in this environment. How do we make the most of that time, whether that's through video recordings, whether that's through long-term group research projects. A lot of that will depend on what that particular content area is. So we didn't want to say, here's exactly what you have to do, and have that be true for math, science, English language arts, Spanish, etc. But instead, we wanted to say, here's what asynchronous learning should be. It should be engaging. It shouldn't be busy work. It shouldn't be additional homework. It should be either a recorded lesson or a video that's been found from another resource with the teacher talking through that and sharing. It could be a group project that's worked on over a period of time with clear accountability and clear deadlines and due dates. So students are working towards something. And so we've tried to provide some clarity in terms of that piece. The other point that I really wanted to point out is this Wednesday time, which does allow for the entire group of students to come back together, but in a virtual setting. And part of this thinking was because of the shift with the AM and the PM in terms of teacher plan time, in terms of teachers needing to invest more time, in terms of the work around their asynchronous learning pieces, was to continue this Wednesday, which allows for additional 2.5 hours in the afternoon of plan time in terms of trying to honor for our staff what that role is going to look like in terms of implementing this. So I hope that answered your question.
Yeah, you did. Thank you.
Alan?
Right, thank you. And thank you, Dr. Simpson, to you and your team for your time helping us gather these questions from the community and sort of organize them for us. It's been very helpful. I just want to say sort of like what I think it was Christine earlier had mentioned, we got a lot of questions from the community. I'm going to focus my questions on getting some of those out for folks instead of my own questions, because I think most of mine would be encompassed throughout this list anyway, but that's going to be sort of what I do here. So the first one would be, can you sort of describe how decisions are made to quarantine a student or staff member and how those decisions affect the parties involved? You know, sort of how is that decision making impacted by the new CDC guidelines, which you had sort of referenced earlier, I think are also important for folks to understand. And sort of as another piece of that, how are we showing them that data on the website, either by district or by school, and the thinking behind that? Sorry, that's a
Thank
big
you.
one.
I saw Sandy's come in. I'm going to write down some of those points. Sandy will respond, and I appreciate that.
So this decision to determine who to quarantine and when is a very complex one. Let me first start off by saying we do not make those determinants as a district. We are not medical professionals. We do not know the health condition of the staff members or of the children. We do not have that information readily available, and how one symptom could negatively impact me more than it would you. So in any instance, when there is a case, we are notified, Human Resources is notified for staff. So then we immediately get on the phone with that staff member and we begin the contact tracing process. And all contact tracing really is it's a series of questions that we ask the staff member. And we're finding out, who they were in contact with, what symptoms they have when they start exhibiting those symptoms. Were you around someone without your mask on, with your mask on? It's a very detailed list of questions. And based off of that, it determines if we need to notify other adults or other children that may have been impacted. Once Human Resources gets this information for staff, our nurses are kind of in charge for gathering that information for their students. Once we have that information, we immediately notify St. Louis County Health Department. We used to be able to call them, but now we're kind of on an email basis with them. So we email them the scenario with all of the pertinent information that they would need to know. And then they provide us with that information. In addition, if I am the person who is the direct contact, or I am the person that is positive, and we are letting that individual know you need to contact your physician or your pediatrician if it's your child, so that your doctor can give you guidance for your own specific health needs. So then the doctor typically provides that initial, Sandy's staying home for the next 10 days at minimum until we can get the test back, but we're going to presume her positive. Or a county is saying, get this person directly to a testing site so that they can be quarantined and they can get tested and they are to stay out until that point. So each situation is going to be case by case. It is all dependent upon the specifics involved in each scenario. I apologize thoroughly, but we do not have a hard and fast answer. You were exposed, so you get quarantined. We don't have those hard and fast numbers or answers because we're not going to try to make those decisions ourselves. So we will definitively have those individuals reach out to their medical professionals, and we'll reach out to county. And with those medical opinions, if the employee or the parent then finds out what should happen with his or her child in a nutshell. In determining the data, we literally have a spreadsheet with each person that we've contact traced. And so we are taking those notes. So if you and I, Alan, are in the same spot and I tested positive, we're hanging tight for you. If you test positive, then we know that was potentially a transmission, right? If you test negative, then it wasn't a transmission. You were just exposed. However, I didn't transmit it to you, right? And so we look at all of those data pieces. The dashboards that we just started posting last week, I think, is reflective of current data as of when the K-2 students return. And so, of course, there is data that occurred with regard to positive cases, et cetera, prior to that date, all the way back to when we first had staff coming in the building, which was back in April. And we do have that data of those contact tracing processes back then, but we did not include that in this current data point. We are including the current data with regard to when the students came back into the building officially for instruction. But we do have that data that runs all the way back to when staff initially came in. I hope that answers your question. John may be stepping in here.
Yeah, I just wanted to go ahead and just share my screen, just so for somebody watching, they might be able to kind of see. And Tim and Kathy, working with Pat Weaver, are working to make our website and our information more easy to read, more accessible. Can you see the website?
Yes.
So anybody that comes here, you can click on the return to school, and you will come here to kind of has the guiding principles. And then right here is the COVID data. You can click on that, and you could see a lot of the different, like this pulls up transmission rate, but we have all the different rates over here where you can see all the data and how it's changed over time. And then right now, the way we've set this up is you click on WGSD active cases, and you get this spreadsheet that's available. And this one was, this is data for the week of October 19th, updated 10/26. Currently, it doesn't look like we have the data that's going to show it like every week, so people can see the historical. But right now, you could see how many cases, how many quarantined students and staff last week, what percentage of students, what percentage of staff does that represent? And then on the far right side is the cumulative. So since we started that return October 14th, how many children does that represent? So.
And Dr. Simpson, sorry, David, if I can ask just a quick
go ahead,
follow-up.
please.
Can you also sort of speak to, because it looks like right now you have the data for the entire district. Can you speak to choosing to do data for the entire district versus by building or by elementary and that sort of thing?
Mm-hmm. Well, I think that different school districts do it different ways, and we our process is to at this point is just feeling like we make sure people who certainly if you're involved in the contact tracing, or if there's a large event in a school, we would notify people. But at this point, we don't know necessarily what the benefit would be. I know some people would like that. Doesn't mean we couldn't move to that, but also trying to be mindful of at this time different laws as it relates to privacy and protection. And there are more people that are suspected maybe than actually ever turn up as a case. And there's a lot of finger pointing and insinuating and inferring. And so our decision at this point has not been to do that. So, but again, we just kind of started reporting it like this. We have the information.
Dr. Simpson, I'd like to piggyback a little bit on what Sandy
please.
said too. Regarding students, just because, I think roughly half of our families have more than one child in our schools. And just because one child is asked to quarantine doesn't mean all of the children in that household need to quarantine. Again, as Sandy said, it depends on the contact tracing and how close an individual was to the positive case. So it could be, if Sandy and I are siblings, I have to quarantine because I've had more contact with the positive case, where Sandy, who might be in a different school, has had no contact with that positive case. So Sandy can continue to come to school. And again, we would base that all on what St. Louis County is telling us, and we would relay that to the family.
Thank you both.
Okay. All right. We're sort of let's go back then. So Keita.
You caught me in mid-chew.
Well, I can come back to you.
No, I'm fine.
Good.
I wanted to go through some of the questions that staff is asking. And this one, I think, was probably a Sandy question. And I can probably combine a couple of them. One is what allowances will be made for staff needing to remain home with the child who has mild symptoms, either being quarantined or waiting on a test, or perhaps a positive case. Will this affect their sick days? If they have to quarantine, does that affect their sick days? Is there going to be some sort of special allowances for these type of situations?
Yeah, great question. So I'm going to encourage teachers who may be listening to this, and we can push it out again tomorrow, but we provided staff with a chart that kind of maps out scenarios and situations and what leave banks could or would look like. So of course they have access to their typical leave bank, but in addition, the Families First Act was passed. And so that affords employees 10 emergency paid sick days for themselves. And should I need to use that for a loved one, a child, or someone that I'm caring for, and or for childcare purposes. So those 10 days are definitively there for any illness related to COVID, and or if there is something related to childcare, they can definitively use that before they tap into their bank. Should there be a discrepancy in their pay, they can use some of their Webster bank in order to offset that. So if they wind up in a 2/3 salary for being in an emergency paid sick leave for their child, they can then utilize 1/3 of their family illness or whatever that is days in order for their pay to be whole at 100%. But we are more than happy, and we have been for each employee where this is applicable. We will sit down with you and talk this through to make sure that you understand. The other piece I want to share is a lot of staff may be on quarantine with their child, and a lot of them are still able to work. because we're very grateful that we've not had any situations where any of our staff's children have had to be hospitalized due to COVID. And so my child is ill, but I can still work. And so if you're working from home, virtually teaching, we're not touching your bank at all, right? Because you're still working. So there is no deduction of their emergency sick leave bank or of their own personal bank because they're still working. If that changes at any point, we will provide coverage for them. And then that's when their days would be impacted. But we will resend that information out to them as well as those scenarios. So hopefully they can have that tangible document to refer back to.
So just to kind of reiterate, so I got a little confused. If they are at home for whatever reason, quarantine for themselves or some, and they're working from home, how does that affect their class? So obviously they're leaving the building so does that then make their class virtual or?
So right now for certain grades, because they're virtual, there is no impact because I may have been, so if I'm a high school teacher right now, I could be working from home right now still, because my kids are home. So there is no impact. However, if I am a kindergarten teacher, my kindergartners are reporting to school each day. And so the teacher and the principal have been in communication. Is the teacher able to create asynchronous lessons that are available in Canvas where a sub coming in can still have access to that information? Is the teacher still able to Zoom? Or is there a way for the teacher to still make contact with the children? If there is a way for the teacher to still provide some type of instruction for their kids throughout the day, we're not touching their bank. If the teacher is home and not working at all, then that's when those emergency sick leave banks will come into play. So because we have been virtual, that has really worked to our benefit because a lot of I'm just staying home. I'm not going to go into the building. I'm just going to stay home. And so my kids are virtual, I'm virtual. Nothing has been impacted for that, but it depends on which grouping you fall in. Did I answer that, Keita?
Yeah, I was just wondering, you answered it because I was wondering about the logistics of, I'm in the class, like say with a kindergarten class, but then now I have to quarantine or what have you. How it was the transition of the class that I was questioning as well. Okay.
I just wanted to add that again, the point that you raised, Keita, is one of those, there's arguments for so many different things that you can make. And that's a strong argument for a virtual program, as Sandy said, because the classroom isn't impacted. Again, if nobody's sick, you just kind of move on. And while there hasn't, to my knowledge, in St. Louis County, been any schools that have moved back from an in-person scenario out, there have been schools around us, districts around us, where again, the capacity to job replace, so to speak, has been impacted by the number of people that are quarantined. Because in a kindergarten room, we'd want to keep all the kids in the kindergarten class. We'd have to have an adult in there with them, obviously, at least one. And so, again, that's just, another data point that we have to consider with these decisions.
Christine.
Yeah, and I'm mindful that I don't think Amy had a chance to ask a question at the end of our first round of questions. Amy, I don't know if you had a question then.
Is that what she probably does?
Followed up on, I think it was Joe's question, so I'm okay for now. But
okay.
Thanks.
Okay. Well, and I really wanted to go back to that because when I heard something about 98 cameras are needed, I'm curious, what are they using now? Are they not using cameras now?
If they're using their home devices, they'll be using their district provided devices in the classroom. So this is what they have in their classroom set up currently, which is the predominantly desktop computers.
Okay.
Good question.
So, when I'm listening to this, I know you would answer this when Keita asked about data information that you've used to arrive at this decision. But again, why not wait until the semester ends? So in January at the high school, for example, where we have 80% capacity, potentially coming back in the middle wonky of a semester. Why not wait until we know more about the spread, when we're through the middle of the winter, when you have answers from parents who are going to be now submitting their information for the spring again. So you'll have an exact count of how many people want to be in the classroom. And then you'll also have more answers to all of these staff questions and student questions. So I guess the question goes back to that.
Yeah, so I would say, like with the high school, the semester is, we still got like another 2.5 months. So we're about at the halfway point. So we don't feel like I feel like the argument for that would probably be better made for Hickson, given the transition at the end of December, than it would the high school, because of how much time that exists there. And so, again, we feel it's not an adult decision. It's not an ease decision. That would certainly be to wait, but it's just the sense of urgency, and not with all kids, but to get our children back in the building, kind of like I mentioned, at the high school specifically, the number of Fs, the number of kids that are struggling social emotionally, just feeling like we need to get them back. And in terms of the questions, I feel like a lot of the questions that were submitted are questions that are all great that people have. There are questions that have been, maybe not all, but a lot of them have been responded to, or they're in documents, or kind of like Sandy said, she's done presentations on. And I think some people naturally, because it hasn't had relevance until now, they may not have seen that, may not have accessed that. So I don't feel like there are as many questions there at the high school for that particular reason. I will say that as we continue to talk to Hickson about their return, some of the different things that have just kind of surfaced recently with them trying to bring kids back, there are some more questions that we just need to continue to problem solve at Hickson. And we are actually doing that with the team, and we'll be actually meeting with them tomorrow morning to talk further about Hickson. But so that's the reason. It's certainly not for ease of any adults that are working on the situation. It's on just feeling like we need to get the children back. Christine, I feel like I missed something in that. Do you remember? You can come back to it.
Okay. Amy?
Oh, Christine kind of sidetracked me there, because now she's got me back on the timing issue. I was really going to move on. But I guess you've heard from parents who are saying, it's good for kids' mental health to be back. And certainly that's true for a lot of kids, but you're also hearing from parents that are saying, don't make us do this now. Give us until the end of the semester. And the response, as I heard, was, that's a long time at the high school, so maybe that doesn't make sense for them. Doesn't make sense to hold off on Hickson. And the reason I have concerns about the timing is just thinking about the disruption, the inevitable disruption. That's nobody's fault, but as you know, we've already had elementary classes quarantined. We are going to have kids who can't go to school because, let's say, they don't have COVID, but they just have allergies or whatever. It's going to be all these absences, which are going to affect, I think about working parents, at least if they knew they had until the end of the semester to make those kinds of arrangements, I think it might be a relief to a lot of parents. That was not a question, that was a statement. I keep doing that. So I will just leave that there, and you can address it if you want to. And then I will just throw in a quick question, and this is one that came from staff. And it highlights the difference between the elementary kids returning and the middle and the high school kids returning, which is at the upper levels, they have hands-on classes such as home ec and music. And how in the world is that going to look? How are you going to have a class full of kids singing or playing instruments or cooking together?
Yeah, and I could speak to that, but I'll let Jason jump in.
Sure. So I'm not going to jump into all of the details, but in working with other districts around, that has been, quite honestly, one of the most difficult areas to try to unpack in terms of practical arts, fine arts, and what that looks like. And so, believe it or not, there are different masks that are now developed that you can still play the flute and maintain a mask at the same time. So I've created and shared with Hickson, Steger, and also the high school administration to share with their staff. I believe it's 10, 11 pages of guidance for each of those areas, particularly at the secondary level. And so the key is really, we keep repeating this over and over and over again, and I know everyone is tired of hearing this, but it is social distancing and it is wearing the mask. And so looking at specialty resources in terms of not only what we can provide, but also how we're cleaning the instrument so that we are making sure that we are taking good care of our instruments, but that we're also being aware of how to best disinfect, especially like string instruments related to orchestra, different guidance as far as what social distancing looks like in regards to some instruments versus others. But the key has very much been to maintain that six foot distance whenever possible. And so some of our spaces are looking at, if they can't have that class and be able to maintain that social distancing experience in that classroom space, looking at an alternative space within the building, going outside whenever possible, that's strongly encouraged. As far as like home ec, cooking, a lot of guidance that districts, and again, this is something that I provided to our staff, has really been to try to group students in terms of 3 or 4 students who will work consistently on their projects together. So that way it's not a rotational plan throughout the class. So, Monday you may cook an egg with this student, Tuesday you may make bread with this student. You would be with a consistent group over the course of your experience. So that way, in terms of contact tracing those pieces, we know who students have spent quite a bit of time with. Also making sure that in terms of materials, equipment, all of that has to be sanitized whenever we are not able to provide individual supplies for students. So like a sewing machine, we can't provide a sewing machine for every individual student, but every time that sewing machine is used in between students, it does need to be disinfected, it does need to be cleaned. And so it's just a completely different way of thinking about, in all of our content areas, how we go about doing it. That's not to say that we don't continue to proceed and we don't continue to explore how we can best do that, but it is a different experience and it is going to take an adjustment. At the elementary level, as an aside, there's been an adjustment in terms of me being able to, pull a small reading group. Normally I would pull 5 or 6 students in my small reading group. Now I'm only able to pull 2 students in order to be able to maintain social distancing. We're still pulling small groups. We're still functioning the way that we were. We just have to think about it in terms of a different way of looking at it. I hope that answered some of your question.
Go ahead, Amy.
Thank you.
I just wanted to add to that because some kind of related to some of the questions is that, and I would encourage people to look in board docs and share it on the website, that video from Dr. Newland that talks about the 3 to 6 feet. And Jason mentioned 6 feet, and that's our goal, and that's ideal. But I'll say that is more likely that you will get less than 6 feet than 6 feet in any of our classrooms. And so it is kind of through that guidance and what the experts would say in infectious disease, that if you get the 3 to 6 feet in your mask, you can do it. And what Jason and all the people say too is, and that we know, is that transmission is very, 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 very rare through any kind of touch. And so we're still being extraordinarily mindful with our cleaning and disinfecting, including in any manipulatives or devices that people use. We're still being very mindful, but I just wanted to kind of articulate that and be really clear with everybody, is that 6 feet of distance, aside from lunch, we have committed to in each of our settings thus far, getting at least 6 feet when kids are taking off the mask for lunch. And that at Hickson Middle School will involve kids in a lot of different spaces in order to accomplish that. So I'll stop.
Can I, is that okay? Because
Go ahead.
That was
Go
one
ahead.
of my questions, was about lunches, since he touched on it. Do you mind maybe elaborating a little bit more on lunches at the high school? And because I know at the elementary schools, they can eat within their classrooms, but not necessarily so at Hickson and the high school. So how will they do lunches?
Yeah, so wherever the expectation is they have to have at least 6 feet. So even at some of our elementary schools, they're not able to get that within their classrooms. So they either have to divide up kids into different areas. Some of our schools are using their gymnasiums where they can get the 6 feet. So they're being really creative to get to that 6 feet marker. At Hickson, they're going to, like I said, they're going to have to use a number of different spaces in order to do that. And that's one of the things that we're just kind of continue walking down the path with them, is just on some of those logistical things in the spaces, not just lunch, but classrooms and all those things. High school, since they won't have, they'll have a grab and go. So students will be able to grab and take the lunch home with them. But as we look to try and get our high school students back 5 days in person, again, being mindful that what the research people are saying is that you get 3 to 6 feet, mask, all these different things. Hybrid in person, it makes no difference in terms of the transmission data. Our goal is to get our high school kids back. And so that is one of those things that we're having to problem solve. Not every district has had that threshold of 6 feet or more for lunch. And they've been contact tracing around lunch. But that's something that we've tried to accomplish. Just because masks off, we know that the risk just goes up.
Can I ask a clarifying question there too, David?
Go for it.
So particularly then at Hickson, how does the construction, and particularly the construction in the cafeteria, impact that?
So at Hickson, they've lost space, and so they have, we knew that there was going to be some level of mobility of teachers, and hearing that level of by mobility, I mean teachers having to go to different classrooms. So right now that is happening at our elementary school level with specialists. Specialists are going into all these different classrooms every day. They're leaving their art room. I saw Miss Cook at Givens today. We all took a school and went to a school, leaving one classroom, had her supplies in one hand, getting ready to go someplace else. So and a number of our specialists at the elementary, to make this work, are also going to different schools. And we had some staff that are shared at different schools anyway, but this is creating more of those situations. So at Hickson, we have a number of staff right now in the current design. It's my understanding they're having to move between classes, which is not ideal, which is an extra burden. And so it's impacting, we knew it was going to impact them some, the construction, regardless of COVID. But given kind of where we're trying to shoot for class sizes, being mindful of transitions, there are just more things that we have to consider. And again, the lunch situation, we will have to look to find people to support them during lunchtime in the current, at least until the end of the semester, so that we can get that 6 feet and space kids out. So that'll be an added cost to us in order to again make that particular happen. There was a concern regarding, safety exits and all that, and those aren't concerns. There are safety things in place. Again, regardless of COVID or not, we were going to be going through construction. There were going to be doors that were closed, windows that are not accessible. So those plans are in place. So I think those are some. Does anybody else want to jump in about Hickson? Okay, I think I first come into mind, Christine.
Joe.
So I'm just wondering, I guess you've referenced a few times that the number of Fs is significantly higher than in years past. Is there any tutoring or what's in place to help those kids that are behind get caught back up before it's too late?
Yeah, one of the things that we did at all of our schools is we created that monitoring program where we brought students in from kindergarten through the high school, students that met certain criteria and were struggling in that virtual program. So that's one thing. Jason, do you want to jump on? I know we talked about this a little bit.
Yeah, I was going to mention the learning monitoring program that's been in place. And I know that our the Webster Groves High School admin team, along with the counselors, have really made an effort to reach out and partner with families to try to get students back on the right track. To say that that's going to happen in every student situation, I can't guarantee that. But that very much has been on the mind of myself, on the mind of our admin team at both Hickson and at the high school. At this point, speaking truthfully and transparently, we don't have a plan for tutoring in place as we move forward. It has been very much to really monitor and invest in our learning monitoring program and to try to partner with families to support them as we continue on in this particular quarter, this particular semester, and moving forward.
And our teachers at the high school do a great job, and it's complicated now by COVID. You'll see a lot of students in teachers' classrooms, like getting extra help before school, after school. And it's just, truthfully, it's just going to be harder. It's going to be harder to do now. And just like we reference kids who are struggling in the monitor program, we're also struggling with the Fs, the high incidence of Fs. We also have students that, parents are concerned, students are concerned, staff are concerned about the reduction in time in like an AP course. And that's, again, both situations are not ideal. So you're considering a lot of different factors, doing the best you can, considering the all, and it's not necessarily ideal maybe for these kids or these kids, but what's best when you're thinking about all the children and all the adults. But we're not in ideal times, so our solutions are not ideal. But we're trying to make the best that we can and learning along the way.
Absolutely. Thank you.
Alex?
Yeah, this is a more specific question about high schoolers and specifically freshmen. Can anything be done to help alleviate maybe that added anxiety that a freshman might be dealing with in going to the high school for the first time? Is there, whether it's going a day early and seeing it, I don't know. Have you guys thought about anything like that?
Thanks, Alex. Yeah, I know both Hickson and all of our schools with that transition are thinking about, is there a way to maybe kind of do something special, for like the freshmen, for the seventh graders. And so those plans will come out soon. But definitely mindful that we have a lot of kids that didn't get to do the Future Leaders experience, which is such a great experience at the high school. It advantages those kids who participate so much. So we are mindful of that. And I know the high school has done some thinking around that. So that information will come out.
Thanks.
Alan?
So I saw in the list of questions that you had sent, Dr. Simpson, there were a couple of questions about at the high school, sort of the fogging of the rooms and the safety of the chemicals that are being used and the timing of it, whether it's being done when teachers are in the rooms or in the building or lunch and those sorts of things. Can you just sort of speak to that process of when the fogging is being done and sort of the safety of the chemicals that are being used?
Yes, and I'll have Pam touch on that.
Yeah, so where our plan is not to be fogging any classrooms. And first of all, can you hear me? I took my headphones off. I want to make sure you can
Yes,
hear me. Thank
we can hear you.
We will not be fogging any classrooms when there are people in the rooms. Our plan has changed a little bit, and we'll be doing all of the fogging of the classrooms in the evening, not during the day in between those two sessions for the high school.
Okay.
Just to follow up on Alan's question, could you talk
Please.
about what you're fogging with and tell us that it's safe, please?
Yeah, so it's an atomizer machine that's doing it, and it is on the APA's list for something that can be used to treat COVID. And it dries quickly, so there won't be, wet surfaces that someone will come in, and there especially won't be since we're going to be using it in the evening when no one's in the building, but it dries within just a couple of minutes.
Is it a chemical? And if so, what's the chemical? Do you know?
It's a disinfectant.
Okay.
Yeah, and sort of to add to that, Pam, while you're looking, I'm just thinking about our staff members that might have asthma or be pregnant or some of those sorts of things. My assumption is that the chemical is perfectly safe, but I think having that assurance would be good.
Yeah, so I can get more detail on that, but like I said, it is the same type of thing that's used to like spray on a surface and wipe it off. It's no different than anything that pretty much anyone is using to disinfect your surface, but I can get that information to you and we can post that in our frequently asked questions.
So John, I'm going to jump in with one here. So we've talked a lot about, for people who may transition between, especially at the high school, may transition between class types during the semester. But can you talk about when students and families will have the opportunity to select for responsive or virtual for the second semester? And can you just sort of talk about what that's going to look like?
I will talk about that. So we've talked a lot about that, and again, always being learners, how we can improve the experience for families, as well as our staff and our operations. So we'll send something out soon. We will the week of, and we have shifted the timeline a bit. It's going to be November 12th to 17th. We're going to put something out to families, asking them to select what they would choose for the second semester. And the question is, and it's going to go through our SIS system. The last time around, it was through Google, and it was more cumbersome for families because if you had 2 children in the district, you had to complete one survey, and then you had to log out. Not log out necessarily, but you had to complete a second survey. So we're going to go through our SIS system where our families have access, and then they'll have a screen where they'll see both their kids, and they'll be able to kind of declare for each child what they select. And we'll over communicate that in advance leading up to that particular time frame. The reason why we have to do that, because I know some people have asked, like, again, kind of like we're talking now, like the data is here. You're asking me to make my decision now. What if the data shifts? And really, it's kind of, we've committed to, our structure is designed to disrupt everything twice. One at the onset, one at the halfway point. And that disruption, again, includes shifting. I mean, we're going to do the best job that we can to not disrupt classrooms, not disrupt teachers, but it's inevitable. It's inevitable to do. And we share staff at a lot of our different schools. And so we can't create schedules at the high school absent schedules at Steger, schedules at Hickson. We have to do it all at the same time. And so based on what people have experienced, knowing kind of what we're saying, answering any questions in advance, I feel people will be better prepared to answer that question this time around, knowing that the second semester for the high school won't start for actually 2 months later. Okay? But that week, we're going to ask people to declare on SIS, and then we are going to reach out to people multiple times if we haven't heard from them, sending them email blasts, and then ultimately having schools contact them. We haven't heard from you. Because the default option, once again, will be the responsive learning plan for any children that are not signed up. Then we are going to send on the 17th, or the 18th rather, a confirmation out to every single family saying, you signed up for this, it's in our records, and then we're going to give them until Friday at 5 p.m. just to, if you have any problems with what we're doing, please let us know. So you've already committed. We hopefully have already got everybody signed up. We're going to confirm once again. If there's any problem, let us know. We're going to give you 4 to 8 hours to let us know. At that point, we'll process all the data on the 23rd. And then the team will come together with administrators, curricular folks, to try and again manage kind of that disruption of all the different kids, all the movement that will occur, and then notify families by Monday, December 7th of what they're planning to do. And again, thinking of not just classes that will have to be impacted, but programs. When you have a child that's going to go from being a responsive learning student to virtual and they get SSD minutes, or they get reading support, or they're in gifted programming, there is a monstrous amount of shifting and planning. And so getting that into the hands of our teachers, again, they may be moving from teaching from home in the virtual setting to being in person, or their class may differ, or the courses that they teach may differ. And so trying to get that in the hands of our teachers and staffs and schools and families 2 weeks before we depart for the winter break and before kids come back shortly after January. So that's kind of what the plan is, and we'll communicate that along with many of these other things with families.
Okay, so I'm conscious that when we set this up, we said we were going to go for an hour and a half. We've gone slightly over that already. I guess I'd crave, if it's possible, can we, if it's all right, we can go till about sort of 6:30. Is that all right for you, John?
Sure, I'll go as long as you want.
So we will call a halt at 6:30. I think that I mean, I think at some point we need to respect your time. As I said at the beginning, we need to respect your time and that of your team. But so, all right, so we'll just, I'll sort of start again, so to speak. So Keita?
Okay, so I just kind of ran across an interesting question. And specifically, it has to do with more so like elementary and I believe a junior high. So students that have special classes like wings, that would normally be pull-out classes, how will those be handled?
Dr. Adams?
Sure. So to answer honestly, again, all of the above. We have some situations like with gifted fine arts where students come from multiple buildings and are typically transported during the school day to one building. We're not doing that at this point. And so students are being provided supervision in their home building, but are meeting virtually with their gifted fine arts teacher. Wings is a similar situation. Reading intervention, we are pulling students, but in smaller groups, and we are trying to limit the number of classrooms that we are pulling students from at the same time in order to honor contact tracing. Same thing with our gifted programming as well, special education services as well. So to answer, it's a combination of, we have some programs that we are supporting students virtually still, and we have some programs where we are able to meet in person.
Okay, that also made me think, and you may have answered it already. Will the third grade orchestra program still be around? Is that a virtual thing now, or is that?
So the strings program?
The strings. Mm-hmm.
Yeah, so at this point, the plan is for that to be virtual. We were looking at some outdoor options as to what that could look like, but obviously with the weather changing and all of that, that just wasn't a good option. And so we have worked with our orchestra teachers, and Des Reicholt, who is our strings coordinator, has been working with them, and the plan is to move forward with it in a virtual format for the time being.
Okay, thank you.
Okay, Christine?
Thank you, David. So I guess I have a two-part question. I think, Sandy, some of this is going to go to you, but I'm curious if any teachers with health risks are going to be forced to return to in-person teaching, because I think we've mentioned that COVID will be in the building. It has been in the buildings, and it is still really dangerous, as we know in my family. And then my second part of that question is, have staff been surveyed? Do we, we have their questions, you have their questions, but is there going to be any kind of regular climate survey, and are they going to be surveyed? Are we going to hear from teachers?
Yes. Can you hear me? I think this thing dropped out of my ear. Okay, to answer the first portion, with regard to staff and their health. So if we have any staff members who are in the high risk category or have a family member who may be in the high risk category, we surveyed them twice before we actually started in August to get that feedback from them. And we've been speaking with them individually and dealing with that on one-on-one basis. So we are not going to put staff in a situation where if I'm at a high risk and being in school, it's not good. So we are going to work through any accommodations, modifications that the doctor has stated. The reason we did it kind of earlier was because it helped us when we were creating our virtual program. It was just easy for those teachers just to be virtual for the year. It just made sense. We assumed, we would be in a better place with COVID, but we aren't. And so just in hindsight, that's what our thinking was. Let's just place those teachers there. There have been some teachers, however, I think maybe medical needs or situations change as they do, life happens. And so they have been reaching out, and we will continue to face that on a day-to-day basis. So our hope is, with all of the protocols we put in place following the CDC guidelines and the health department, is that the environment that our teachers are in, as well as disinfecting the building, is safe. We have had people in the building for a while. And again, back to John's point, minimal transitions, but the exposure, unfortunately, it's there. I mean, the moment you walk out your door, it is there. And there is no way we can remedy that. There's no way anybody can remedy that. It's unfortunately an airborne virus. And so the best that we believe we can do is providing them with the protection, the face covering, the dividers, et cetera, and should their doctor ask for additional accommodations or modifications, we will put those in place for them. We absolutely will. Whether it means entering a different door or being in a different location, we will do that for them. So that'll be our goal. So if there are any teachers out there who are concerned, and rightfully so, about your health or the health of your loved one, please reach out to us so that we can process and go through that process individually, because that's really massive to try to do as a whole group. Your second question, can you repeat that one for me?
Sorry, my computer gets really slow when I have my video on. Are we listening to teachers as we're making these decisions? Are they being surveyed? And will there be any future any regular surveying of teachers?
Yeah, so that's a hard one. So in my role in HR, we, of course, being a part of the issues committee, I'm hearing a lot of what the teachers are saying through other teachers, right? In some of the meetings that I'm in, I'm hearing that teachers don't want another survey. It's another thing to have to do. And so I have been asking my committees, how are we going to get this feedback? So we have been getting some feedback just through verbal, right? In a staff meeting or in a conversation, what's going on here or there. But my hope is that, and I can definitely reach out. We have a issues meeting coming up pretty soon and figure out if that's something that we want to establish and what are the right timeframes to do it. We heard from K2 teachers, they didn't want another thing because they were thinking about coming back. And now 3-5 is thinking about coming back, and then potentially 6-12. And so when is there a good time? However, our hope is that the teachers that are in the buildings have the pulse and are hearing from their colleagues and can bring it back to us so that we can understand the culture in the buildings and the districts to be able to respond to it effectively. So to be quite honest with you, I've not set up any specific surveys. If they want that, I'd be happy to set it up and set it up on time frames that works best for them. So I'll get that feedback from the committee. I think we meet in a week or two. I'll get that feedback from them. And if we need to set those up, then we can communicate those out. But what I've heard is, I don't want another survey, and rightfully so. It's just a lot going on. And so, but if that is something that we can set up to better get a pulse, absolutely, we'll do it in order for us to get that feedback.
So I was going to mention a survey, but we'll clearly talk to the issues group about that. But we'd surveyed teachers at the 2-week mark, the 4-week mark. Then our method was to, in 6 weeks, send something out. I was thinking, for the teachers who are still virtual, for the teachers who are in person, as well as the students and the families, the same people that we had surveyed before. But we'll talk about that from a learning standpoint, from a climate standpoint, with that group. That's the group to do it with. They're great.
Amy.
All right, I have a question and then a comment, of course. Question first. So, and I know this number has been put out there, and I apologize. You probably even said it during this meeting, and I just don't remember it. But how many kids do we have currently in the responsive learning plan? Ballpark. I don't need the exact numbers. In terms of, how about as a percentage of the overall? You're on mute, John.
Read my lips. I can give you a percent. I had that number somewhere, but it's either 70% or 73% at elementary or middle school. It's 80% at the high school, about 80% at the high school. And that's one of those things about the high school. Obviously, when you bring back the kids in the hybrid model, 40% of them will be there. So that the space will be much more, exist there much more.
So here's why I'm asking this question. That's a lot. I apologize. I just thought of this during this meeting, or I would have given you a heads up that I was going to ask this question. Sure. But so we pay for kids to participate in lunch. We, being the school district, pays for it. So if we have that high percentage of kids decide that they're not ready to come back now, and they're going to go to lunch, let's say for the rest of this semester and or the next semester, next semester, at what point does it make financial sense for the district to provide its own virtual program as opposed to paying lunch? Have you guys done that analysis?
Well, we know what the cost, and Jason, you could jump in, or Pam, you would have better. So we have a budget for launch, because we've had kids that have been using launch for some time. Obviously, it was part of our summer school program. We are spending more in launch than we anticipated, just due to the COVID and stuff like that. Do you guys want to share what the numbers are related to that?
I mean, there has to be a point. I know this from working with other school districts. There's a point at which it just doesn't make financial sense to keep giving our money to lunch. And you can also solve some of our problems with staff who might need the accommodation of working virtually by creating a Webster Groves virtual program. And I'm sure you guys have thought of that, but I'm just curious what those numbers would have to look like.
Yeah. You're on mute, Jason.
Sorry. So as far as Edgenuity, and that's why I brought up Edgenuity this evening, we've already purchased a site-based license for the high school. And so as we add students, we don't have to continue to pay for additional students through Edgenuity. We've already upfront purchased that program for this year. And that is something that the high school, I believe, has had in the past in order to provide virtual options for students or alternative programming. And so that's what makes Edgenuity enticing. As far as
sorry, real quick, Jason, can families choose though? Do they have to do we say you have to do Edgenuity, or can they choose launch or another MOCAP program?
Honestly, with MOCAP, families have the choice to choose from any of the MOCAP options.
So it would be nice if they choose Edgenuity, but yeah.
Exactly.
Gotcha.
But part of what Dr. Dimbo did to help us out when she first started back was I asked her to do, because honestly, being new to this role, I haven't had a lot of experience with MOCAP. So I asked her to do a research analysis on all of the different MOCAP providers as we were looking at just being prepared moving forward with these options. And so Edgenuity was one that came to the top. Launch was one that came to the top, and a program called Accelerate, which we have not placed students in. Launch was able to work with us for many districts. I don't know if I don't want to make news for other districts, but a lot of districts are not able to enter students into Launch at this point. Launch is working with us because of our close relationship that we've had with them, in particular with Dr. Dimbo over the past few years. And so that is how we've been able to navigate during this particular transition. So to speak to the actual numbers, I'm not going to be able to answer in terms of when that tipping point would be, but to just put it out there, for a high school course for one student at the high school level, it's $225 for that completion of that course. For an elementary student, because they're getting all of their content areas, they're getting their specials programming as well, it is around $1,100 for an individual student. And so at this point, at K6, as Dr. Simpson said earlier, we have around 40 students who have enrolled in this next quarter through the completion of this semester who were in the responsive program and who are now moving forward in the launch program going forward. So without being able to give you that tipping point number, we are monitoring the number of students that are going into that program. And yes, that does impact our decision-making, especially that impacted our decision-making as we started out this process at the beginning of this year. And as we look at continuing our own virtual program into next semester, it is better to use our staff. It is better to use our technology to the best that we can to create and continue our virtual program. We are providing this as an option for families who just didn't feel comfortable going back at this point. And so the idea is not to necessarily develop our virtual program going forward around these third-party vendors.
So in terms of thinking about, I mean, I understand the elementary's going back and, but I would think you would want to know from the families who are in the responsive learning plan at the 6 and above level, who's going to opt out at this point and do lunch. And because if it's really that high of a percentage of families, it could be a significant cost to the district. And could that affect your decision to start back prior to next semester? If enough people said, we're choosing lunch, and then you guys are looking at the bill for that, would that cause you to reconsider the decision to go back prior to next semester? For kids, and I'm talking about kids 6 through 12.
I mean, I think if we, I wouldn't want to do that. I wouldn't want to do that first. I wouldn't want to base the decision on that. I would want to kind of move forward and then, you know, see what ends up happening. You know, I still think everything is a balance. There's so many factors. Everything is a balance, and I wouldn't want the possibility of people moving to affect that. I think we have to consider the finances, obviously, with everything that we do, and we are. But I wouldn't want to do that first, personally.
I'm viewing the financial piece as almost a backdoor to the question of what do families really want to do for the rest of the semester if they've chosen responsive. And so if you hear from them, set the financial piece aside, you know, we really would prefer to stay virtual, Webster virtual for the rest of the semester. And there was a significant financial incentive to allow that. Would you reconsider?
Yeah. I hear what you're saying, and I think I think we would have to think about, you know, again, the impact on teachers, the impact on what we know we feel is best for kids, and money. And money, we're always mindful of. Sometimes we have to make decisions regarding, but there are a lot of.
That's not my.
No, I know for sure. 100%.
That's David's
100%
line, not mine. But 100%. I mean, I think it is a fair question because there is cost associated with it.
Absolutely.
And David, I'm just going to go into the statement portion of my time, and then I promise I'll stop talking because I know we're on time crunch. But I just want to say I realize this decision is not with. I don't have a say in it at this point, and it's probably a done deal. But I do want to respectfully express my preference would be to allow 6 through 12 to stay virtual for the rest of the semester for several reasons. Their transmission rates are closer to that of adults. You know, little kids apparently aren't spreading it as frequently or as easily as teenagers and adults. They, unlike elementary, where I get it's near impossible to try to do a virtual classroom, middle school and high schoolers can do it. They've been doing it. It's not ideal. There are significant concerns about mental health, but I would prefer to make sure that we're protecting their physical health and then doing some proactive measures to shore up support for mental health. And then to the extent that when we do bring kids back, I think that we have an opportunity to bring back the kids who need it the most, as opposed to forcing kids to go back who are doing okay. Some are doing okay, again, not great, it's not ideal, but kids who are getting by academically could use some additional mental health support, emotional support. then put the kids in the buildings who need to be there, whether they're at risk for a variety of reasons, special education, et cetera. So I've said my piece. I realize I'm just one person, but I just needed to say that. And
Thank
also,
you.
I don't take at all lightly the amount of work and thought, and it's not personal. I respect you guys tremendously. I hope you know that.
All right, Alex.
Yeah, so I was actually not, I think we kind of spoke a little bit about Hickson, but I'm not 100% sure if this question was answered, and it's just in the number of students and teachers passing in between class periods. Is that a cause for concern? Have you, I guess kind of just, I guess ultimately, what's the decision behind, what's the thought behind going back 5 days a week there as opposed to a hybrid model, given those circumstances?
Yeah, thank you. Again, kind of, I mean, not again, because I answered it, because I haven't answered that yet, Alex. But referencing the medical professionals, and if you watch Dr. Newland on the video, who is definitely an expert and has been a leader in the region with infectious disease, is that they're not concerned about passing times in hallways and as far as transmission, because it's not going to be a space where kids are gathered for a very long time, and they're going to be masked, and they're going to be moving to and fro. And so while we will be mindful with structure in those passing times, we'll be mindful of supervision. Those aren't concerns of ours. What we do want to make sure is that at both Hickson and the high school, and again, continuing to problem solve with those groups, is that we do have the ability to adequately supervise those spaces. Again, probably more attention needs to be given to Hickson than Webster Groves High School with that. So in terms of the in-person, and it's kind of, I'll speak a little bit to what Amy said, is that, again, from an academic side, we know the benefits of in-person. Having more time with the teacher, more time around a counselor, more time around your peers, it's just better. We haven't been able to do that, and rightfully so, but it's better. And then along with what the others will say, the infectious disease people will say, what you will read is that the transmission rates are no different in a hybrid and an in-person. Again, it's, like we've said, COVID exists within our community, exists within our world. People are going to walk in with it. But there hasn't been a marked difference between what it looks like in a hybrid and an in-person environment. Hybrid is easier because you have fewer kids to contact trace, fewer kids that possibly may have to quarantine. Those are real considerations we have to do. And you have to balance that with the effect on all those other sides, the learning side. So the goal with all of our settings is the in-person. It's realistic that hybrid is a possibility at any of our settings at any of our time, based on what we're able to do. But right now, not based on our ability to keep necessarily people safe from getting COVID. I do want to talk real quick to kind of one of the things that Amy had said and not respond to all of her things. I'm grateful for any feedback or thoughts. But one of the things that Dr. Newland said recently, I mean, some of the other infectious disease people have said, is that we know that children, our young children, just like our older children, do get the virus. And there's a lot of things like, why we're not seeing the transmission in the younger kids as we are the older. They will say that largely it's being passed from the adults to the children. But that it's likely that there's not a big difference between the possibilities of transmission in a young child versus an older child, but it's that our older children are more mobile, they're more independent, they're working jobs, they're gathering with friends. And so that's why you'll see the numbers in the transmission. In Webster Groves School District since March 1st, there's been 127 cases of children between the age of 5 and 19. 13-year-olds, 5 to 9-year-olds, 13 cases, 10 to 14, 16, 15 to 19, 98. And that's not just district children, that's anybody who lives within the district. past 14 days, there's been somewhere between 1 and 10 is how they code the data. And 5 to 9 and 15 to 19, there's been no transmissions in children aged 10 to 14. And that's 14-day data pulled on the 20th. So, so again, a lot more content than you asked for. We may have to move to hybrid at different settings. And we have to be flexible with that. But the goal is to try and get all the kids in person and to be able to safely do it.
Thank you.
Okay. And Alan.
All right, thank you, David. Question for maybe you, Dr. Simpson, or perhaps Dr. Wiley. We've been thinking about our district, our teachers are one of our greatest resources, and thinking about all the things that they're going through, no matter what we choose, this extra stress that's on them, the extra things that are on their plate, whether we're virtual or in person or what's on their plate. One thing that I'm concerned about is staff morale and the thought of losing a lot of our good teachers at the end of the year. And I know that's on your guys' mind as well, but love to hear sort of what your thoughts are on that. Like I said, it's probably not something you can answer now, but I just encourage you to continue to think about what we can do to help that staff morale and teacher retention, knowing that they're such a valuable resource for us.
And do you want to jump in and then I'll share?
Yeah, that mute button seems to hide every once in a while, sorry. So it's true. It is something that I process often. It is something that we think about, which is why we try to get face-to-face as many times as we can with people. We try to individualize and do a lot of one-on-ones to make their experience more personalized and help them to see that we value them in their unique situation. 100%. But it's not just our teachers, right? It's our support staff. It's all of our staff that have been working since April. People who were working in buildings where nobody else was present, just them,
Yeah.
And so, I'm sorry, go ahead, Alan.
I was going to say, thank you for that. I should have said teachers, staff, and administrators, everybody up and down the line, right? Like that's really important.
Yeah, and just the, COVID, this virus has created dynamics in families that people never thought. And the negative impact it is having on children, and for adults to see these impacts on their children. But then there really is no easy answer to resolve it. And those same adults then have to report to work, and so what's the balance? I have no idea. I have my own struggles, right, with my son. And what does that look like? And I just don't know. The only thing that I can continue to try to do is listen and make sure that we are continuing to be mindful. I do I appreciate Christine's question about surveying and the culture. And, we've had those questions, but teachers, I just want to teach, to see some of their faces today, how excited the adults were to see kids. The kids, of course, were excited, but then you also had some teachers that were extremely nervous. And how do you balance that? And it's just extremely difficult. And I wish things were different, but unfortunately they're not, but we will be mindful of it. I know I'm taking up a lot of time, but we will continue to be mindful of it. So thank you, Alan, for the question.
I just wanted to add to that, and that's just that I think it's a really good question. I was recently, I don't know who was interviewing me, but there was I don't know if it was top 3 concerns, worries, but one of them was teacher and staff retention. This job is so incredibly hard. And I try to tell people all the time is people try to simplify it. But when you have all these children that have these very unique and beautiful minds and experiences, circumstances, it's really hard to connect with them. It's really hard to teach them and care for them. And you throw this onto it and you throw on, again, up the line from teachers to staff to administrators, the criticism that comes with it's not good enough or more. And it's not that anybody's making decisions because they don't care about them. But sometimes that gets lost as people advocate for their own child, which you get, or their own situation. And so I do have a lot of concern and worry for good people that we will lose. I've seen it in colleagues around the region who are just kind of like, you know what, something else for me at this point. And you get it and you understand it. So I do think we can't be more mindful of that. I think about my own self, and now more than ever, I get lost, not lost. I'm working, I'm problem solving, I'm doing all these things. But that is in my own haste and my own urgency, it's detracting from that level of care or that level of connectedness. That is something that I value and has been a strength of mine for a long time. So, and I don't think I'm different from a lot of people with that. So I appreciate it too. I know everyone's talked about teachers and staff here tonight, and I think that's something that we have to, as we're in the tyranny of the urgent, and as we're faced with all these things, just to care for people as best we can. And that's where some of our decisions that we make are centered, thinking, being mindful of our teachers and the staff and the people that are doing the really hard work. So anyway, thanks for that.
All right. Okay, so I said we'd go to 6:30. We're already at 6:35. I mean, there are, as has been referenced, we had a lot of questions here. I know that John, you and your team are going to go through all of the questions. You're going to go and update over the next few days, and week or so. You're going to go and update the FAQs for that. I think we're going to call a halt to this now. I'd like to thank everybody for their time. And then I think at our next board meeting, we will discuss perhaps how we can have a town hall to get some more active feedback from the community as well. That'll be after the end of sort of teaching through December, and we'll have a better idea as to how things are going. We'll talk about that at the next board meeting. At this point, I'll entertain a motion to adjourn.
Make a motion to adjourn.
A second.
Second.
Thank you. All in favor of adjourning? Aye?
Aye.
Anybody opposed? Thank you very much. And again, thank you, John. Thank you to the rest of your team. And thank you, board members as well.